Good morning, and let me start by saying something that might shock you. Something your doctor has probably never brought up in any of your appointments. Something that gets whispered about but never properly explained. And something that the medical establishment has been embarrassingly slow to talk about openly. If you are over the age of 60 and you have stopped this particular activity, or you were told it was no longer appropriate for your age, you may be unknowingly accelerating your physical and cognitive decline in ways that no supplement, no medication, and no morning walk can fully reverse. Today, we're talking about masturbation in older age, what happens when sexual self-care disappears from your life, and why this conversation deserves far more honesty than it has traditionally received. I'm Dr. James Carter, and welcome to Dr. James Carter Health, where we turn complex medical research into practical information you can actually use. Over the years, I've spoken with countless older adults who felt embarrassed, dismissed, or simply unsure whether sexuality still belonged in their lives. Many assumed that once they reached a certain age, intimacy became irrelevant. Others believed self-pleasure was something they should outgrow. The truth is much more nuanced. Sexual health is health. It doesn't suddenly become unimportant at 60, 70, or even 80. While masturbation is certainly not a magic cure for aging, emerging evidence suggests that maintaining a healthy sexual life may support emotional well-being, circulation, pelvic function, stress regulation, and overall quality of life. Before we go any further, I want to ask you something. Have you ever had a doctor bring up sexual health as part of a routine checkup? Not because you asked, but because they thought it mattered enough to discuss. Let me know in the comments how old you are and whether this topic has ever been part of your healthcare conversations. You may discover you're far from alone, and if you value honest, evidence-based discussions that treat older adults with dignity and respect, take a moment to like this video, subscribe to Dr. James Carter Health, and share it with someone who could benefit from hearing that growing older does not mean giving up on every aspect of intimacy and self-connection. Today we're counting down 5 important ways that stopping sexual self-stimulation may affect the aging body and mind. These are not meant to frighten you, and they certainly aren't meant to suggest that everyone must engage in sexual activity to age well. Rather, they're meant to provide information, challenge outdated assumptions, and encourage thoughtful conversations about an often ignored aspect of health. Let's begin. The first topic many people never expect to hear about is the connection between sexual activity and the pelvic floor. The pelvic floor is a group of muscles located at the base of the pelvis. Think of them as a supportive hammock that helps hold the bladder, bowel, and, in women, the uterus in place. These muscles also play a major role in controlling urination and bowel function. Like every other muscle group in the body, the pelvic floor responds to use and inactivity. As we age, these muscles naturally lose some strength and coordination. Hormonal changes, childbirth, surgeries, chronic coughing, constipation, and reduced physical activity can all contribute to weakening over time. What many people don't realize is that sexual arousal and orgasm involve rhythmic contractions of these muscles. Those contractions may provide another opportunity for pelvic floor activation. For women, pelvic floor weakness can contribute to stress urinary incontinence, the leakage that sometimes occurs during coughing, sneezing, laughing, or lifting something heavy. This issue affects millions of older women and often goes unspoken due to embarrassment. While pelvic floor exercises, often called Kegels, remain one of the most established approaches for strengthening these muscles, some research suggests that regular sexual activity may support awareness and coordination of pelvic floor function as part of an overall healthy lifestyle. Coordination matters just as much as strength. Imagine trying to dance using muscles that only know how to tighten but never fully relax. Effective pelvic floor function requires both contraction and release. Sexual response naturally incorporates both phases. For men, conversations about pelvic health frequently lead to the prostate. The prostate is a small gland located below the bladder. As men age, it often enlarges through a condition called benign prostatic hyperplasia, or BPH. This enlargement is extremely common and can contribute to symptoms such as frequent urination, nighttime bathroom trips, and difficulty fully emptying the bladder. You may have heard claims that ejaculation dramatically prevents prostate disease. The reality is more measured. Some observational studies have found associations between more frequent ejaculation and lower rates of certain prostate conditions, including prostate cancer. However, these studies show correlation rather than direct cause and effect. Researchers continue to investigate the reasons behind these findings. What we can say is that ejaculation is a normal biological process and appears safe for most healthy older adults. I remember speaking with a gentleman in his 70s who had stopped all forms of sexual expression after losing his spouse. He felt guilty even considering self-pleasure, believing it somehow dishonored the memory of his marriage. After discussing the biology involved and reassuring him that caring for his own health wasn't an act of betrayal, his perspective changed. Months later, he told me he felt more rested, less tense, and more connected to himself again. Was that entirely because of masturbation? Probably not. But sometimes the permission to acknowledge your humanity can be therapeutic in ways medicine cannot fully measure. If sexual self-care is something you choose to engage in, there is no universally correct frequency. The healthiest approach is the one that feels physically comfortable, emotionally appropriate, and aligned with your personal values. Now let's move to something many people rarely connect with sexuality at all: heart health. When people think about protecting their cardiovascular system, they often picture treadmills, salads, and blood pressure medications. Rarely does sexual activity enter the conversation. Yet sexual response activates multiple systems involved in cardiovascular function. During arousal, heart rate rises, blood flow increases, blood vessels expand. Following orgasm, many individuals experience a period of relaxation accompanied by reductions in tension and stress. These responses involve nitric oxide, a molecule that helps blood vessels relax and improve circulation. Nitric oxide is one reason certain medications for erectile dysfunction work. They enhance pathways that support blood vessel dilation. Healthy blood vessels need flexibility. Think of a new garden hose. Water flows smoothly because the material can adapt to changing pressure. Over time, blood vessels can become stiffer due to aging, high blood pressure, smoking, diabetes, and inflammation. Lifestyle habits that support vascular health remain incredibly important. Regular physical activity, maintaining healthy cholesterol levels, avoiding tobacco, managing blood sugar, prioritizing sleep, and reducing chronic stress all play major roles. Sexual activity appears to fit within this broader picture. Several studies have observed that adults who maintain satisfying sexual relationships often report better cardiovascular outcomes and improved overall well-being. However, sexual activity should be viewed as one piece of a much larger health puzzle, not a replacement for medical care or healthy habits. One woman I spoke with after recovering from a cardiac event had interpreted "take it easy" as avoid all forms of intimacy forever. Fear had quietly entered an area of life that once brought comfort and joy. After discussing the importance of individualized guidance from her healthcare team, she gradually regained confidence. She learned that, for many patients who have been medically cleared, moderate sexual activity is both possible and safe. The emotional relief she experienced was almost as significant as the physical benefits. Fear often steals more from us than illness itself. It's also worth acknowledging the profound effect sexual activity can have on stress. Stress hormones, particularly cortisol, influence blood pressure, immune function, sleep quality, appetite, and mood. Periods of intimacy and orgasm are associated with the release of chemicals such as oxytocin and endorphins. Oxytocin is sometimes called the bonding hormone because it contributes to feelings of closeness and trust. Endorphins act as natural pain relievers and mood enhancers. Again, these aren't miracle substances, but they are part of the body's remarkable ability to regulate itself. If this conversation is challenging assumptions you've held for decades, I encourage you to keep an open mind as we continue. Aging doesn't erase your biology. It changes it, yes, but it doesn't eliminate your need for comfort, connection, pleasure, and dignity. And that's where we're headed next. In the second half of this discussion, we'll explore how sexual activity may intersect with hormone regulation, emotional resilience, brain health, and, perhaps most importantly, your sense of identity as you age. We'll talk about what current research actually says about memory and cognition, why loneliness can have profound consequences for health, and why so many older adults quietly grieve the loss of a part of themselves they assumed they had to surrender. Most importantly, we'll discuss why giving yourself permission to remain fully human might be one of the healthiest choices you make. If you've made it this far, thank you for trusting me with a topic that deserves compassion rather than judgment. Before you go, please take a moment to like this video, subscribe to Dr. James Carter Health, and share your thoughts in the comments. Tell me your age and answer this question honestly. What is one aspect of your health that no doctor has ever asked you about, but you wish they had? Your voice matters. Your experiences matter. And the conversations we avoid are often the ones we need most. If you stayed with me this far, thank you. The fact that you're still listening tells me something important. It tells me you're willing to challenge old beliefs and explore the possibility that aging isn't about shrinking your life to fit society's expectations. It's about adapting, learning, and continuing to care for every aspect of your well-being, including the parts people have taught you to ignore. Let's continue our countdown. One area where sexuality and aging intersect in fascinating ways is hormone regulation. As we grow older, our hormonal landscape changes. This is a natural part of life. Men experience gradual declines in testosterone over the years. Women go through menopause, bringing shifts in estrogen, progesterone, and even testosterone levels. These changes can influence energy, mood, sleep quality, sexual desire, muscle strength, and overall vitality. Many people assume these changes mean the end of sexuality, but biology isn't that simple. Sexual arousal and orgasm trigger a cascade of chemical signals throughout the body. During these experiences, the brain communicates with endocrine glands, the organs responsible for hormone production. Chemicals such as dopamine, oxytocin, serotonin, and endorphins increase temporarily. Dopamine is often described as the brain's motivation and reward chemical. It contributes to feelings of pleasure and reinforces behaviors associated with well-being. Serotonin helps regulate mood, emotional balance, and sleep. Oxytocin supports feelings of closeness, trust, and relaxation. Endorphins act as the body's natural pain-relieving compounds. These temporary shifts don't replace medical treatments when someone has a true hormone deficiency. They won't cure menopause symptoms or eliminate age-related hormonal changes. However, they may contribute to emotional resilience and overall quality of life. Some observational studies have suggested that older adults who remain sexually active tend to report better mood, greater life satisfaction, and higher perceived vitality compared to those who do not. It's important to understand that these studies cannot prove cause and effect. Do healthier people engage in more sexual activity, or does maintaining intimacy contribute to better health? The answer is probably a bit of both. What matters is recognizing that sexuality doesn't disappear simply because birthdays accumulate. Women often face particular challenges after menopause that deserve compassionate discussion. Declining estrogen levels can contribute to vaginal dryness, thinning of tissues, and discomfort during intimacy. This condition, known medically as genitourinary syndrome of menopause, affects many women but is dramatically underreported. Too many suffer in silence. Some assume discomfort is something they simply have to endure. Others feel embarrassed to bring it up. The good news is that help exists. Vaginal moisturizers, lubricants, pelvic floor therapy, prescription treatments, and open conversations with healthcare providers can make a tremendous difference. For some women, maintaining gentle sexual activity, including self-stimulation if desired, may help preserve awareness of bodily responses and encourage circulation to the area. Again, this isn't a cure-all. It's simply one piece of a larger picture of sexual wellness. Men face their own challenges. Erectile changes become more common with age due to factors such as reduced blood flow, diabetes, medication side effects, stress, cardiovascular disease, and hormonal shifts. An erection at 70 may not behave exactly like one at 25, and that's okay. One of the greatest misconceptions about aging is that sexuality must look exactly the way it once did. It doesn't. Pleasure evolves, intimacy evolves, expectations can evolve too. Sometimes, adjusting our definition of sexuality allows us to rediscover aspects of it we thought we'd lost forever. Now we arrive at one of the most intriguing areas of modern research, the brain. For decades, scientists believed the adult brain stopped producing new cells. Today, we know that's not entirely true. The brain retains a remarkable ability called neuroplasticity. Neuroplasticity refers to the brain's capacity to adapt, reorganize, and form new connections throughout life. Think of it as your brain's ability to renovate itself. Learning new skills, exercising, socializing, managing stress, and engaging in mentally stimulating activities all support this process. Researchers have become increasingly interested in understanding whether sexual activity might also play a role. Some studies have found associations between sexual activity and better performance on certain measures of memory, verbal fluency, and executive functioning. Executive function refers to the brain's management system. It helps you organize information, solve problems, make decisions, and adapt to changing situations. These findings are encouraging. However, they should be interpreted carefully. The research doesn't prove that masturbation prevents dementia. It doesn't guarantee protection against Alzheimer's disease, but it does suggest that maintaining a fulfilling intimate life may be one of many behaviors associated with healthy cognitive aging. Why might this be? Part of the explanation may involve stress reduction. Chronic stress exposes the brain to persistently elevated cortisol levels. Over time, excessive cortisol can affect mood, sleep, concentration, and memory. Periods of pleasure and relaxation may help counterbalance some of these effects. Another explanation involves emotional engagement. Human beings thrive on connection. And this brings us to a topic that rarely receives the attention it deserves: loneliness. Loneliness is not simply being alone. Many people enjoy solitude. Loneliness is the painful feeling of disconnection. It's the sense that meaningful closeness has disappeared from your life. After retirement, the loss of a spouse, children moving away, declining mobility, or changing social circles, many older adults experience profound isolation. In fact, public health experts increasingly recognize loneliness as a major concern among aging populations because of its association with depression, reduced quality of life, and poorer health outcomes. When we discuss sexual health, we're also discussing self-worth. We're discussing identity. We're discussing the need to feel alive. For some individuals, self-pleasure becomes an expression of self-compassion rather than merely a physical act. It can be a reminder that they remain connected to their own bodies, that they still deserve comfort, that they still matter. I once spoke with an older woman who had recently received a diagnosis of mild cognitive impairment. She was frightened. Not just of memory loss, she feared losing the essence of who she was. During our conversations, we reviewed everything within her control: exercise, sleep, social engagement, nutrition, mental stimulation, stress management, and maintaining activities that brought her joy. Months later, she shared something profound. "I stopped acting like life was ending," she said. "I started participating in it again." Whether that meant walking with friends, gardening, reading novels, dancing in her kitchen, or reconnecting with parts of herself she'd neglected, the transformation was visible. Hope itself can be therapeutic. And now we've arrived at what I believe may be the most important point of all. The greatest consequence of abandoning sexuality in later life isn't necessarily physical. It's psychological. Many older adults receive messages throughout their lives suggesting sexuality belongs only to the young. Advertisements celebrate youth. Movies portray romance as something that fades after middle age. Even healthcare providers sometimes avoid these conversations entirely. Eventually, people internalize those messages. They stop seeing themselves as desirable. They stop seeing themselves as worthy of pleasure. They stop recognizing themselves as whole human beings. This process has been described by some researchers as sexual disengagement. The danger isn't simply the absence of sexual activity. The danger is the loss of identity. It's the quiet belief that an essential part of yourself no longer deserves attention, that your needs no longer matter, that your humanity has an expiration date. I want to challenge that belief. You are not less human because you are older. You are not inappropriate for having desires. You are not broken if intimacy looks different than it once did. You are not selfish for prioritizing your own well-being. And you certainly do not need permission from society to acknowledge the reality of your own experiences. For some people, maintaining sexual expression will remain an important aspect of life. For others, companionship, affection, conversation, creativity, spirituality, or service to others may occupy a more central role. There is no universal formula. The goal is authenticity. The goal is living in a way that honors your physical health, emotional needs, personal values, and changing circumstances. If sexual self-care is part of that picture for you, there is nothing shameful about it. If it isn't, that's okay too. The real message is choice, informed choice. Aging successfully isn't about pretending certain needs disappear. It's about understanding yourself well enough to decide what truly supports your well-being. As we bring this conversation to a close, here's what I hope you'll remember. Your body changes with age, but it does not stop deserving care. Your mind changes with age, but it continues to adapt, learn, and seek meaning. Your emotional needs evolve, but they do not vanish. And your sexuality, whether expressed through partnership, private self-care, affection, or simply acknowledging that this part of you exists, remains part of your humanity. Masturbation is not a miracle treatment. It is not a substitute for exercise, balanced nutrition, medical care, meaningful relationships, or appropriate medications. But neither is it something to fear, hide, or automatically abandon simply because you've celebrated another birthday. The healthiest approach is one rooted in respect. Respect for science, respect for your values, respect for your changing body, and above all, respect for yourself. If this video encouraged you to think differently about aging and sexual health, I invite you to continue this journey with me. Here at Dr. James Carter Health, we're committed to bringing you evidence-based information without judgment, fear, or embarrassment. Please subscribe to the channel and turn on notifications so you never miss our weekly discussions designed to help you live with confidence and clarity through every decade of life. If you found value in today's conversation, give this video a thumbs up and share it with someone who might need reassurance that growing older does not mean giving up on feeling alive. And before you go, I'd love to hear from you. How old are you? What's one health topic you wish doctors talked about more openly? Leave your thoughts in the comments below. I read as many as I can, and your experiences often help shape future conversations on this channel. Until next time, take care of your body, protect your mind, nurture your spirit, and remember this: aging isn't about merely surviving the years you've been given. It's about continuing to live them fully, with dignity, curiosity, compassion, and the courage to embrace every part of what makes you human. I'm Dr. James Carter, and thank you for spending this time with me. I'll see you in the next video.